Thank you very much indeed. Well, let me extend not only a thanks to those joining, but a thanks to those who have organised this, and that's the International Society of Measurement of Physical Behaviour. It's a real pleasure to be part of this, and I recognise the speakers who are going to support and provide valuable contributions to this and the discussion. My task is to set the scene from vision to guidance. I think many of us for about a decade or longer have been talking about the possibilities, the opportunities, and maybe some of you share some frustration about how long it's taking to get wearables more widely used, both in research, interventions, monitoring, evaluation, and specifically, and for this evening, the surveillance agenda. My task is fourfold over the next 15 or so minutes, and it's a big ask. I want to introduce why, and I've expanded on that. What is the policy context here? The mandate to look at data and improve how we collect, and the goal of the piece of work and work plan, which I'm pleased to share with you and hope I can engage all of you on. It then gets down to what have we done, where are we now, and where are we going? And I'm followed by speakers who I'm grateful for, who will expand on much of that, where are we now and where are we going, as drawing on all of your help and expertise is needed. So let me start with the background for many, but I know on this call it will be familiar, but if it's new, I want to quick step through some of the reasons why we're here, why this is important, and why we have an agenda. So WHO's role is listed here in a variety of 6 or 7 different points. Those in green are the ones that really stand out. It is WHO's role to provide norms and standards on what we do and how we do it, and many have been involved in guidelines, to monitor and assess trends over time. And I put at the last one there to shape the research agenda. And I think all 3 of these are highly relevant to today and the topic of wearables and population health, public health. The actual policy platform that I remind you of and introduce to those who are newer to this field, from the left, the Global Action Plan from 2018, really providing a platform of what we're doing, why we're doing it, and where we're going, a little more later. The guidelines that tell us that physical activity is important and sedentary behaviour is a risk, how much and what to do. The status report that's keeping us on track, where are we, what are we doing, and are we doing enough? And then, of course, the essence of this, monitoring the participation, the levels of physical activity in all populations, but I show you last year's publication in adults. The Global Action Plan set out not only the actions, but a target. Critical, I would offer, to have something to aim for, something to measure and hold account. And for those of you who have got an eye for measurement this evening, it is more precisely a 15% relative reduction in the global prevalence of physical inactivity, to be defined, in both adults and adolescents. You can immediately tell we have a measuring job. The Global Action Plan sets out the policy actions, but I draw your attention in this presentation to the top right, the governance and systems that will make it all happen, and shout when it's not. And look where the arrows are pointing to, because it calls for strong, robust data systems to track, measure, and inform policy decisions. That's part of our mandate. If you're writing a grant, trying to persuade your boss or yourselves to invest, it is here that physical activity is mandated, and I draw your attention. Specifically, for those interested, Action 4.2 says we need to enhance the data we have, the population surveillance of physical activity and sedentary behaviours. And back in 2018, we were pegging that we need to develop and test new technologies. Tasks were called for, and WHO was asked to provide leadership in the monitoring and to ensure the latest methods and evidence are used to enhance and harness the global guidance and surveillance tools. But you all have a role. Research, funders, academics, leaders, policymakers, to support this agenda. And so I would like to now just pause, as population surveillance may well be newer to some than on this call than many. So what exactly is population surveillance? Well, it's the ongoing systematic collection and analysis of data to inform the action and interventions, and to hold account by evaluating our progress. It monitors health, diseases, the risk factors in the whole population. It provides trends over time. It informs how we allocate resources to planning and policy. Good decision making, I'd like to say, also follows the funding. I think we have work to do there because our evidence is strong, but the funding doesn't quite follow in the proportion required. And it's a core public health function that all countries do, and physical activity is included in this process. To bring a picture to those words, it's about measuring how much physical activity whole populations do. And WHO has a role in doing that and supporting countries to do it nationally, and then to seek global harmonization and global comparisons to enable us all to learn from each other. And to put it down to another way and to labour the point a little, many of you may measure at the individual level or small group level or intervention or even cohort, but supersize that to the whole population, take a sample and then try to a randomly representative sample, and then we need to measure the physical activity of importance. That's what today is about. So what exactly are we trying to measure? Well, of course, the guidelines on physical activity showing the dose-response relationship between physical activity and all health outcomes, generalized on the y-axis, but we know what could be put there from all-cause mortality, CVD, diabetes, etc. We know from the green line that more is better, and we have a recommended level of the amount and type of physical activity for benefits. We call that the guideline, and we need to measure the population prevalence of meeting or not meeting the guideline. Behind that, of course, are multiple messages. We see the green line going up. We know more is better. We haven't defined that. Some is better than none. We know that for interventions. And the new kid on the block, not so new now and well established, is there is an interesting and important relationship with the time spent sitting or sedentary behaviours. To look at what we need to measure, we can see it by the more detailed description of all of the guidelines from WHO, replicated in many countries. And I've just illustrated that we have the moderate to vigorous physical activity in the middle for adults and for adolescents. And we want to measure this to report the percent that meet the recommendations. At the sedentary end, there are various recommendations or ways to measure it. WHO right now does not have a specific measurable target on sedentary time. We may return to that. So if we know what population surveillance is, we know what we're trying to measure, what instruments are we using now? Well, I've pulled this out with the kind help from colleagues, and this is from the most recent assessment in adults only, as this will be the focus. And we know that the Global Physical Activity Questionnaire developed by WHO, also the International Physical Activity Questionnaire, IPAC, are used a lot. In addition, some countries have similar but different and combinations of IPAC and GPAC. And a big thanks to Dr. Tessa Strain, who helped put this summary data together with me. And you can see it's a mixed picture, but overall, the countries are using this self-report measure in combinations, predominantly GPAC, followed by IPAC and combinations thereof. And for interest, 31 countries don't have any data that's usable in these sort of comparative work. So how about devices? Well, thanks to my colleague, Dr. Wana Williamson, we looked at the most recent data from the 2023 survey from countries. 16 countries report having used devices, but it does span from some years ago. And of course, that's where we are, talking about why is it so few and how can we change that? We know that self-report have limitations. This audience knows it better than most. And on the right are some of those. Too many questions, takes too long, feels repetitive, confusing. Show cards try, but they don't really work. It's really hard to estimate times of last week. And actually the science show it's weak to moderate validity of these instruments. They have served us well, but is this good enough? Is this the only way? And of course, this audience knows my next slide, that there are alternatives. Alternatives, as the introduction said, that are getting more affordable, more familiar, more usable. And therefore, it's time to look at how we can look at these and introduce them into the population surveillance. There may be something more on the horizon, but today we're looking, and WHO is looking at, how these instruments that really are in the research community very familiar, but as I showed from the last slide, not at all familiar and not at all acceptable and scaling yet in the population surveillance. And I remind you of my first slides. The fundamental role of governments is to track physical activity as a risk factor for non-communicable disease in the best possible ways regularly. So we have an instrument that we could use. You've all been talking about it. Here's just a small sample of the many papers, reviews, opinions, and research that is tackling this. And I commend that and draw attention to those that are looking at some of the challenges, some of those that are looking at how we could standardize, some of those that are looking at where we are in the prevalence of use of those. Many papers, and some of you are on this call, and I'm very delighted to see you joining us. But there are problems. Many in these papers and elsewhere are saying, if we don't standardize what we're doing and how we do it and how we analyze and what we report, we are following the track of self-report history, and we need to fix it. There we are. WHO's objective is to develop global guidance on the use of wearables for population surveillance in adults and adolescents. Why? Because we have two targets of those populations. We'll probably add sleep, and we will probably add the other age groups in due course. We're ambitious, but we're also starting where we can. So our goal is to replace the page on the right, which is a placeholder of how do we use objective measurement in population surveillance. And for WHO, it's the STEP system. I'm delighted to introduce that WHO has got a process. We can officially formalize this development of guidance under developing a technical product profile. On the left is showing you the guideline and guidance of how we together can produce it. And you can see in there the different steps that are all quite well laid out for an end to end. It's not as simple as just what the device is. It's from end to end. How do we get it used? How all the way through to reporting. And that's the journey we're starting. I'm absolutely delighted to share with you that there are some examples, not the ones that you might expect. Hearing aids and frontline worker characteristics of PPE, but they exist. It's a process. So I'm very pleased to announce that we will and are on a journey to produce the technical product profile for wearable devices for physical activity and sedentary behavior measurement. This is the way we can, equivalent to guidelines, but within the structures and processes of WHO. So what have we done on that journey? Well, we've had two important meetings that scoped and really assessed, can we, should we, self-report have done well, but where do we, how will we introduce wearables going forward? And these reports are available and the QR codes are there. I'm absolutely delighted to say that we've had the third meeting, and imminently, days, hours maybe, that report will be online on the WHO website. A third meeting looking at more specifics of those specific technologies and devices that I'll speak to now. So this is not new and not starting tonight. In fact, it started over a year or so ago. So where have we got to in what we know? Well, our last meeting, the one I referred to in Montreal, with great thanks to those that supported and attended, we have agreed that we need to narrow down and focus on perhaps 3 core measures. Start simple, stay focused. Let's get the guidelines on how to do this for these 3 measures. MVPA to report meeting recommendations, step count, and sedentary behaviours, because step counts are very likely to be a new guideline in the future 2030. And sedentary behaviour is very likely to get measurable rather than just reduce extended times. Until it is, we haven't got the metric exactly to report. What does that look like back on the guideline picture? Here. Down at the end, we've got to measure sedentary, and in the middle, we must measure the MVPA. I fully acknowledge the interest on the right, light, specific behaviours, cycling, and others, but we're starting simple and focused. Our progress to date, specifically in Montreal, identified some of the device specifications, feeding into that product profile that I've just introduced. 4 areas have been agreed. Wear location should be wrist-worn, primarily because it works and it's feasible. Other areas, other wear locations are possible, but this is important that it's feasible for population surveillance. Triaxial, raw data, wear time 7 days. Our guidelines are 7 days. You will be interested, I know, in the report from the Montreal online in a few days, because it shows you what we concluded on all of the device specifications. And you will hear more from speakers in the session today. This is the at-a-glance table, and it shows you some of the specific device properties, feedback to users, filter frequency, epoch length, band fitting, wear time, etc., etc. This is the summary table, and the appendix shows you all of the detailed discussion with a clear definition. Many are confirmed with the best opinions that we have drawn on to date. Some are unfinished. So therefore, in bringing this to a close, what are the key areas that we need to we have agreed on? And you can see here, we've agreed that we can focus on these three metrics. And we've agreed, point number 2, that the characteristics of the device and some of the features of wearing it, protocols. We've also looked for and agreed that there are available open source, non-proprietary methods and algorithms that can help all countries implement this device going into the future. A phrase, good to go, has driven us and challenged us in each of our meetings. But it's not completely satisfactory. There are further developments needed. And in particular, we've identified the need for further evaluation of some of the algorithms and set out a research agenda. This research agenda is summarized here and in the Montreal report. Interestingly, most of the results are published by the people who develop the algorithms and own the data sets. It would be highly desirable to have independent evaluation on a common data set to enable comparison, to enable objectivity. The second area is the development research. We recognize it's not perfect. Thirdly, we need more studies in lower middle income countries. And when we get to the next step, we need to demonstrate in the field with countries using the guidelines, the draft guidelines, so we can refine them. And one other learning from our meetings is we must keep listening to countries and learning from those who've tried. And therefore, in conclusion, I can tell you that's where we are now. And the meeting coming up, which I'm delighted to let you all know about, is this month in Utrecht in the Netherlands, kindly supported by the government of the Netherlands and our colleagues. And we will meet again with a group of people who are kindly sharing their experiences to review country experiences, evaluate specific elements of the wrist-worn device and specifically measuring cycling, and to continue this idea of what research gaps and knowledge we must continue to build. More will follow and we will share with you. I think I've really given you a flavor of what's next. It's a big agenda, but if we don't start, we'll never get there. So we're very delighted that we've started, and we really appreciate all the thanks from the 3 meetings thus far, the many conversations I've had with many of you, the work that many of you may be engaged and help us with. And I'd like to finish with a quote from one of the delegates of the meeting. Let us not let perfection get in the way of starting. It's time for this transformational leap in surveillance of physical activity methods. Thank you very much.